here we have bariatric surgery, 20-year results. As you can see, out to 20 years here. You have the gastric bypass, initially 35% weight loss. Out 20 years, you're still getting, you know, a good amount of weight loss. You're still getting about 20–25%, right? The reason why is because of the change in those hormones. So here is a schematic of the 4 different procedures. The gastric band is just a band around the stomach. The Roux-en-Y gastric bypass, which is the gold standard, and also the sleeve gastrectomy up here, and the more aggressive biliopancreatic diversion. What do they all do? They all change the hormones that go from the gut to the brain. So what changes in the gold standard here is, yes, you see you're making a small pouch for a stomach, and the food goes through here now and bypasses the rest of the stomach and small intestine. Well, when it goes through this way, ghrelin is secreted right here. So ghrelin is a short-term hormone indicating hunger. And you see the food completely bypasses that. And what it sees earlier in the jejunum is the satiety hormones, PYY, GLP-1, CCK. Those go up earlier in the course of the progression as the food goes down into the gut. And so those hormones are then secreted in the brain, and you get satiety with less food. You see how that works? The sleeve gastrectomy, you also see decreased ghrelin levels because you're completely cutting off this part of the stomach and throwing it away where ghrelin is secreted. The band doesn't do any of that. You're not getting any bypass with the band. And so because of that, patients who had the gastric band lost weight because of the restriction. All right, there's a narrowing here. But those hormones reared back their ugly heads, and patients got really hungry and expanded this pouch here. So you see, and then the biliopancreatic diversion over here is much more aggressive, where not only do you throw this piece of stomach away, but you also bypass almost all of the intestine, and therefore completely change so many of the hormones that people lose a lot of weight, but they also malabsorb because you're bypassing all of the intestine. You're malabsorbing now. And that creates a situation where there are many more complications. So we really recommend the Roux-en-Y gastric bypass as the gold standard because of most weight loss here, most resolution of diabetes, and then the sleeve secondarily.